You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Hiers. Today's topic, sedation dentistry. According to my first guest, that there are millions of people across the country that don't go to the dentist because of the fear of the dentist. Also, he says that with sedation dentistry, you can go in and get like 6 months worth of dental work done all in one visit because of sedation. And he says, and there's a lot of people afraid of the dentist. Don't let your fear of the dentist keep you from having the smile you've always wanted. With us, we have Dr. Randy Hiers. Dr. Hiers, welcome to the program.
Oh, thank you for having me. It's such a pleasure and a blessing to be here.
Now, we've had you on the program before talking about dental implants. But,
yes.
But you are like the sedation guy where you are, like the go-to guy.
You're Randy,
right?
we do a lot of sedation. I've gotten to the point where I do IV sedation, we do oral sedation, we even do nitrous oxide. It just depends on the patient's need.
And who benefits the most, by the way, from this? I mean, like who are the type of patients that need IV sedation?
Well, sometimes it's me that benefits the most because I don't have to be nervous about what they're feeling or what they're worrying about. Okay. But the patient, for these people, most of these people, they haven't been to the dentist for 10, 15 years. And in 2 appointments, we can get them all back together again. It's a wonderful, wonderful experience for them and us. It's one of those transforming experiences.
So it's a fear. Like are these like almost like dental phobics?
Yes, these most often are dental phobics. To give you an example, Randy, I had a patient in just recently, and his name was Bob, and I walked in the room and he had the yellow bib on. The yellow bib in our office means my assistants say this is a sedation patient.
They're afraid of the dentist.
This guy's afraid.
They get the
I
yellow
walked
bib.
in and I looked, and he is physically shaking in the chair.
Okay.
Shaking. I mean, he's shaking. And I walked in and introduced myself, and he said, Doc, he said, I've never been to the dentist, and I think I'm going to have to be sedated. And this gentleman was almost 60 years old.
Never been?
Never been to the dentist.
Okay.
And I looked at him and I said, Bob, I looked him square in the eye. I said, one of us is going to have to be sedated. And I prefer it be you. He looked, and he got this great big grin on his face, and he said, I think we're going to get along. And he stopped shaking.
So I guess when you're dealing with somebody that's so afraid, you have to kind of break the ice.
Absolutely.
With some humor.
You got to have a relationship with these people before you're gonna.
So that was your icebreaker.
Yeah, it was just one of those. It was the perfect moment for him. So for him, we were able to replace missing teeth with bridges. We were able to restore teeth with fillings. We were able to clean him up. He had periodontal disease. We were able to control that. Now he comes for regular checkups and cleanings. He's got no problems. And he's not even afraid to come anymore. That's what's really amazing. This guy was so afraid that he was shaking. He actually comes and has this done without sedation now. It's amazing. It's been a wonderful transformation. He's become a friend. You said the best part about this whole thing is his appearance. I mean, he's not afraid to smile. One of the things was, he said to me before we went into this, he said, all I've ever wanted to do was smile. His teeth were brown in the front. And this was actually something that occurred in his childhood. And all he wanted to do was smile. So we were able to cosmetically, we fixed all the front teeth. And when he was done, we gave him a mirror on his way out.
Okay.
And he stopped. And he said, Doc, you did it. And this is a burly guy. He's a really burly guy. And I was like, oh my gosh, this guy's gotten tears in his eyes. He had tears rolling down his face as he's being rolled out the office. And I'm moving to another part because I was like, man, this is just cool. This is the kind of thing. This is what I live to do dentistry for. To see that kind of reaction, that kind of change in individual lives. He's smiling all the time now. It's been great. So Randy, when he came back, I asked him, I said, well, did anybody say anything about your teeth? He said, are you kidding? everybody's noticed my teeth. He said, because now I'm smiling all the time. I never smiled before, and I smile all the time. That was, you know, he walks around smiling. I think he had to learn it, but because he was so used to, he was actually covering his mouth with.
You say he's your friend now.
Yes.
So he acts differently just
He
because
acts
of his
totally
teeth?
differently. He was very nervous coming into the office. As I said, he was scared to death. He didn't know what to expect. He didn't have any perspective. Everything's restored.
So as a general dentist, I guess very few general dentists across the country do IV sedation.
It's a small percentage. It's a very small percentage.
Like less than what, 10%?
I think it's less than 4% actually. The last time I heard.
All right.
But the reasoning is that as a general dentist, because we do all the different procedures in our office, we're able to transfer somebody in 1 or 2 visits instead of sending them to multiple people or specialists to have the same things done. We do them all under one roof.
So under one roof, you do like root canals,
Do the
right
root
there?
canals, the crowns, the veneers, all the cosmetic things.
And you're the dental implant king.
We do the.
Also.
I
I know you don't like when I call you that.
No, I
but
don't
you
like
do
it.
a lot of dental implants.
Yeah, we can do the implants all at the same time. And all this at the same time while there's sedation, one arch, another sedation, the lower, and then we're done.
So you studied sedation.
Mm-hmm.
Why'd you get the training?
You know, it was
Because you said there's a lot of work to get certified.
yeah, I think it's a hassle to get certified. I actually went to 3 different programs to be certified in the sedation. I started out in Miami Valley Hospital in Ohio. Then I went to Montefiore in New York. And then I actually went to the Medical College of Georgia. And there's a lot of training, and then you have to be licensed within your own state, and they all have particular standards, and then you have to meet the board's protocol for your particular state. But Randy, it's worth it. It's worth it to do what you can do for these people. It's worth it to be trained, to be able to change somebody's life. There are so many more people you can help through the IV sedation because you have much greater control with the IV.
Is it safe? I mean, is it safer?
It's actually statistically safer than the oral sedation because the control is there. And
What do you mean by that, the control?
Okay. When I do an oral sedation, I'm giving a drug like you would take up any other pill, and it goes through your system and goes through your gut, and then it's distributed in your system. When I do an IV, so I have to wait for that oral drug to work. So that can take 30 minutes. With an IV, I put it in, and within 2 minutes, I know exactly where you are, and I can adjust it up or down, and depending on where you are at any given time. And I want you basically just this side of sleep. I want you comfortable. I want you happy. I want you not to care about what I'm doing, saying, what's going on in the room. It doesn't matter.
You talk to them to make sure they're out of it?
Yeah, we're talking to him, and oftentimes they'll drift in and they'll snore a little bit, and then they'll like, where am I? Oh.
So for some people, you could do a complete smile makeover, as
Right.
we talked on the phone. Smile makeover, and it could be like 3 hours, 4 hours, whatever. You did dental implants, you did veneers, and they almost don't remember what happened. To them, it's like 10 minutes?
Yes, they have no concept of time, and they say, well, sometimes, did you do anything yet? Well, yeah, we're done now. And we tell them that. But there's been such a transformation to so many of these people. One of the ones that, can I tell? Do you have time to tell you a story?
We have all day.
All right.
No, I'm kidding. Go ahead.
I remember this one lady, a woman, and I'm just going to use the name Patty, and I came into the room and I looked, and there's people all around the room. Her whole family's there. And I looked, and this woman's sitting in the chair, and she won't look at me. She make no eye contact.
First time meeting her.
First time I met this woman, would
won't
not
look at you.
make any eye contact with me. Wouldn't even talk to me.
She was that scared.
She was that afraid.
Okay.
And so her daughter's over in this corner, and her daughter says, well, our mom she can't eat anymore. And she's got all these health she has all these health issues. And I said, well, I'm glad you guys got her here. Well, we almost didn't got her here. She said it just like, didn't got her here. She said she tried to get away on the way here. And I said, well, I'm glad you got her back in the car and got her here. I said, so what kind of issues is she having? And they said her health is deteriorating. She's losing weight because she's not eating. And I said, well, let's see what we can do. And we got the diagnostic records. And I said, Patty, are you willing to at least give me a shot at trying to help you? She still wouldn't answer. And her daughter answered, yeah, she's going to do this. The family had gotten together because they were worried about their
like an interventional.
Yeah, they were going to take care of this no matter what. They were going to help her. So we got her going. We had her back, and we're going to do the first sedation. And this is the first words this woman spoke to me.
Okay.
She's in the chair. I'm getting ready to do the IV. She said, you know, when I go to the hospital, they can never get an IV started. They actually have to call the neonatal unit. That's the babies to get this started. I said, this is going to be real fun. So, get the turn on, got the IV started.
First time?
First time, Patty goes out. She wakes up. We completed the lower arch. We got the fillings done, the crowns done, the cleaning, we got all of it done. Still wouldn't talk to me. Came back, did a complete makeover on the upper arch.
Okay.
Same situation. Got her all done. Still very little conversation, but
all right.
I could tell the ice might be breaking. So she comes out. She was back to the office, I think it was last week. And I come by and I was walking out and I see her at the front desk. And I look and she looks up at me and she mouths the words, thank you.
Nice.
And I said, great smile. And I walked in the back and I got all choked up because here's a woman that wouldn't even acknowledge, wouldn't even speak to me. And she was smiling. She had this great big smile.
So you couldn't have done that without sedation?
There is no way I could have done that.
So you like this kind of a patient? Because I've talked to dentists on this show and they say, I don't like these phobic patients. You have the temperament for this?
Absolutely. You know, this is transformational. That's what makes a difference.
You think the smile, you're a dentist, right? So you probably think the smile's pretty important.
Yeah, I think so. I think Zig Ziglar said it. He said, you know, your smile is your logo. He said your personality is your business card. And the way you leave people feeling is their trademark.
Okay.
So, you know, in any magazine, anything you read, the smile, it's everything. It actually, I just read an article on the internet that was talking about the importance of the smile and how it actually is a positive feedback to your brain. It actually is more powerful than chocolate. And being a chocoholic.
So when you smile, you can't be miserable.
Yeah,
I've heard that.
I find that hard to believe, being a chocoholic, that it's better than chocolate, but that's what the research shows. So yes.
I think you told me too, you say in just about every survey what you find attractive in another person, smile is always in the top three.
Absolutely. Always. I mean, you know, everything else is covered up. You can't cover it up that. So even in a job interview, I mean, you know, one smiling, one not. If everything else is equal, who are you going to choose?
Yeah, the one that looks happy, I guess.
Absolutely, especially in my business. I've got to have them at the front desk. They have to have that persona. That's the business I'm in. So that's extremely important.
So, okay, so the highly anxious, if you don't like your smile, they go. And so where you are, you have a reputation as the sedation, that you do sedation.
Yes.
Now you do different levels. You do the nitrous. I love nitrous, I told you.
Right.
It's relaxing when you're there. Even for cleanings, you get the nitrous.
Right.
You also do the pill,
right,
oral sedation. What are your thoughts? And I think I even asked you this on the phone. But I have dentists that go, Randy, I have a soft touch. Randy, people that have been on my show, they go, my patients don't need any sedation, any nitrous, and they say, I calm them.
There is no doubt in my mind, every patient that comes in there has something that's bothering them. Some people don't like the textures. They don't like the paste. They don't like the sound. They don't like the smell. There's so many different...
The drill sound is terrible.
It is. It is. And even the drills have gotten better, but they're still not great. So what we've done is we tailor the sedation to the individual. So the night before, they get a pill. They take the pill so they get a good night's sleep. The morning of, they get another pill. That's about an hour before they get to the office. They come to the office and I ask them some questions.
Okay.
And I say, if I don't like your answer, you're going to get more pills or sedation with IV. Whatever it takes, that's what we're going to do. So they know that coming in. So we've already established a protocol, whatever it's going to take to get that individual where they need to be so that we can work on them. It might be just nitrous. And many people...
The nitrous is, I mean, that's fantastic.
Yeah, and the nitrous
I'm trying not to endorse you, but it really is good.
Yeah, and the nitrous is fine. A lot of times after
For small things.
Yeah, once they've gotten through all the big things, the nitrous is like, oh, well, that's just like, keeps me kind of cool. So I don't have to have so for regular cleaning, I don't need all the complete sedation. I can just do nitrous.
The second group of people that you said you get are the people that are in a hurry, like these type A, they're business people, they're very successful, and they'll use an excuse, as you say, I don't have time to go down there. But you can do 6 months worth of dentistry in one visit because of sedation. What does that mean?
Well, because it's very difficult to have a person in and do 5 or 6 hours worth of work on them and have them not exhausted, and they have no concept of time with the sedation, to take them in and do all their work for them, it's well worth it.
Yeah.
Because time to most of these individuals is money, and we can do it so quickly, get them in, get them done, and they're back doing whatever they do. And that makes them extremely happy.
You know, I looked at your prices. I asked you, I mean, it's not expensive to get sedation,
No.
IV sedation. And nitrous is like nothing.
Right, comparatively, yeah.
You know, for the bigger procedures, you should look for a sedation dentist, right? I mean, is that your feeling?
Well, certainly. There's 50% of the population has some level of fear of the dentist. In fact, there's a whole 50% of the population that doesn't even go to the dentist.
Because,
Because of that. But there's also, even the ones that go, 50% of them have some level of fear. If you look at the surveys, they have some level of fear. So there's just, in this day and age, there's just no need for that.
And you don't even remember the procedure. Like you could go in and get a full mouth of veneers, you look at the mirror when you're done, and it's like, it seemed like 5 minutes.
Right.
It seems like everybody would even want this, like they would ask for it.
Yeah, but I don't think there's an experience thing with that. They don't know. Most of the time I'll ask them about a week later, and I get the same response over and over again. They remember being wheeled out, getting in the car. Most often, that's all they remember. The point I think is most important is that there's no reason for fear to be the reason that you don't go to the dentist anymore. It's just not a valid point. That's what sedation is all about. And those people that have unbelievable time commitments or time restraints, and they need to get a lot done in a very short amount of time, all in one place, that's the answer for them. I'm thinking of a particular individual that I had in, and Larry was in that category. He's
the busy guy.
Yeah, busy guy, and he had some health issues, but he was a busy guy, and he had a really sensitive gag reflex. I mean, really sensitive.
Okay.
And so he pretty much avoided the dentist. And I got to talking to him, and I said, I think we can help you. I think we can make this happen. And I talked to his cardiologist, and he was on some medications because of his heart rate and all, and we got it all worked out, and we got his medications adjusted for the appointment, and we said, here we go. So we got him in, we sedated him, we got his front teeth fixed, he got this beautiful smile. He comes back in a week later. I said, Larry, what do you remember? He said, tap, tap, tap. I said, tap, tap, tap. Yeah, tap, tap, tap. I said, Larry, that's the last thing we did before you left the office. We were checking the bite. I said, is that all you remember? He said, yeah, but I lost my wallet on the way out. I said, yeah, because I was trying to push the wheelchair and you let it fall out of your pocket and I couldn't push you anymore because it stopped the wheelchair. He said, yeah, I remember that. He said, but I don't remember anything else. I said, how are you doing with the smile? He said, oh. He said, why would anybody do it any other way? That's the message. So he was able to combine time and his problem being a gag reflex instead of fear, but it truly was a fear because he was always afraid that would get going, and that had always been his problem in the past, that he couldn't get past that. People can't even clean his teeth without him gagging. So we were able to accomplish all that in one appointment. For people like this, it changes everything. It changes their self-esteem, the way they react socially with other people, their interactions, their relationships. All these things are changed by just a simple visit. It can be one, it might be 2 visits, but everything can change in such a short amount of time and so easily now.
You love this, don't you? Because I've had you on the show a couple of times. I mean, do you live, eat, and breathe this?
I really do. I mean, if
you go home and talk about it?
Yeah, well, if anybody was to, they talk about me and they say, this guy is an absolute workaholic. But it's because I love what I do. I tell people, they say, well, why don't you just retire? I'm like, why would I retire? I love doing this stuff.
So this is how you get your kicks.
This is it.
Because you say, you're changing people's lives every day in your office.
Every day.
But it's just teeth. But it's more than that.
No, man, it's not just teeth. It's everything about them. The smile it's like the gateway to their soul. I mean, that's what it is. And if I can add that one thing, if I can do that one thing for him or her, it's a blessing. It's a blessing to be able to do these things. Well, it's like they say living the dream.
You're living the dream.
I'm living the dream.
So you were meant to do this. So we are just about out of time, but for a patient watching this, and maybe they haven't been to the dentist, you said, 15 years. You had one patient, 60 years, he's never been to a dentist.
Yeah.
Right? Your training is to help, dental implants. I mean, you do it all under one roof, right?
Right.
So what's that consult like? And what do the sedation patients want to know? What are their fears?
The sedation patients,
what do they ask you?
Does it hurt? Does it hurt? Am I going to feel anything? That's all they're interested in. They really aren't interested in anything else. That's. I mean,
you mean putting the IV in? They're wondering, does that hurt?
Well, again, remember, I've already pre-sedated them.
Oh, so they took a pill before
they did the pill before. They did the pill the morning of. So they're already kind of, I'm asking them questions. And I don't even want to give you the questions because then when I ask the questions, I already know the answer.
I got you.
Yeah, I can't give you the questions. So, they're already semi in a state of,
they don't care.
They're comfortable. Yeah, they're comfortable most of the time at that point. And so the IV is not the issue. It's all the experiences they had prior to this. Childhood experiences, all these things play into how they're thinking. So they're trying to, they want to read into everything that's going to happen, and they don't realize that nothing's going to happen that they remember.
All right.
So that is it. So often I think of all these people that have the sedation, and I get through, and if we're doing, for instance, we're doing extractions, and they say, well, did you extract my teeth yet? Yes. That's why you have that gauze in there. And they don't have a clue. And it's
So your buddies, you go to dental conferences, like you said, you're always at a dental conference or training.
doing something.
And do you always tell your guys it's worth spending the time to do sedation?
You know,
Because you said it's a hassle to learn to do.
you know,
And get the license and get your facility licensed.
I think
Do you tell people to do it?
no, actually, it's so much personal choice. I think there's a lot of people that just don't have the personality to want to do this, because it can be very stressful to deal with these people up front. I think about my clinical administrator and what she has to do just to get them scheduled. I mean,
They're that afraid.
they're that afraid. You know, the lion ate my child. You know, they're going to make up an excuse not to come or do something. You know, it's after their grandmother dies the fourth time, it's like you need to come up with something else, or you need to come to your appointment. You know, so it's that type of thing.
That's good. Now we're out of time, but so you're equipped for these people that are afraid,
Yes.
and your team,
Yes.
they get it.
They get it. Yeah.
So you don't guilt trip them when they come in. You haven't been to the dentist in 16 years?
No. Why? Hey, everybody's life gets in the way, Randy. If I woke up in the morning and said to you, my teeth are the first thing I'd think about, I wouldn't be telling you the truth. Come on.
Yeah. I mean, I like my dentist, and I never want to see him again. I mean, you don't want to go to the dentist. Nobody does.
Yeah,
right?
But yeah, that's right. Nobody does. But this is once they make that leap of faith, if you will.
Okay.
It's the first day.
Do you have conversions?
Yeah. Hey,
People that hated the dentist, now they actually look forward to coming to the dentist?
I'm not sure that they'd go look forward to it.
Okay.
But now they come on a regular basis and they don't even need.
But you were about to say, and I interrupted, that it's the first day
of the rest of their life. That's the first day. Once you
you fix that smile.
Yeah. And they
Good for
realize that, hey, I lived through this and everything's fine. It's all okay now. And I've got something that really works for me. I mean, it's transformation.
So come in, get it done. Free consultation.
Please.
All right. I want to thank you for coming to the show.
Oh, thank you so much.
Excellent stuff.
Thank you so much.
You've been watching The Wellness Hour. I'm Randy Alvarez for now. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.